Inside Lenox Hill Hospital in Manhattan, the fight against the coronavirus has changed drastically.
1 month ago on this unit, alarm bells everywhere.
Dr. Nazish Ilyas and her colleagues are still treating COVID-19 patients, but much less frequently.
Right now, this is the hospital's only COVID unit. At one point at the height of the pandemic, it had about 20 and it was dealing with more than 300 patients across the hospital. On this day, just 6.
But they're now preparing for a potential second wave later this year, coinciding with flu season. They now know they can triple their number of ICU beds. On-site testing has improved, but there's still a shortage of reagents, the chemicals needed to conduct the tests, which are often made overseas. As America reopens,
We just have to be ready. People are socially distancing still, hand hygiene. You can't completely control this disease despite all the preventative measures, but I think it definitely helps.
At the pandemic's peak, a quarter of the patients here were critically ill. A makeshift morgue set up outside. Dr. Ilyas herself got sick.
I never thought we would end up being the epicenter of the world.
Everyone here remembers March 7th, the first COVID patient. The next few weeks were a blur of long shifts and longer nights.
Did you ever think it would get as bad as it did?
No.
Dr. Linda Kirchenbaum is an experienced critical care physician. Even for her, the onslaught was shocking.
Seeing a husband and wife die together of COVID in the same room of the same disease, I've never seen that in my career.
Dr. Jill Coleman is the hospital's executive director. It was on her to make sure there were enough ventilators, enough beds, enough protective equipment.
As patients were coming in rapidly and dying rapidly, every night when we just thought we weren't ahead of it, when we might not have PP, we might not have vents, those were the moments where you said, is everybody going to be okay? That's a stress.
This emergency room was transformed into a COVID unit almost overnight. It's now back to normal. But for nurses like Marina DiMattia, the emotional scars are fresh.
I can't tell you how many times I went home and cried and thought about all the things I could have, should have, would have done. And ultimately we did everything we could do, every single one of us.
Every night at 7 o'clock, she cherishes the New Yorkers who still cheer Frontline Workers.
It's overwhelming. When we were in it, it was just about getting through it and helping as many people as we can. It was something I've never seen before. It's something I hope I never see again.
Here, they won the battle. The war may not be over. Gabe Gutierrez, NBC News, New York.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.